Let's talk about anesthesiology. Anesthesiologists are a critical importance in the OR. They're the ones that monitor your vital signs and keep you alive. They monitor your medications, they monitor your vital signs, and if anything goes wrong, they're the ones that are going to resuscitate you, not the surgeons. They're the ones that know how to keep you alive in that regard. So it's important to know who your anesthesiologist is, but unfortunately, most of the time, you don't meet the anesthesiologist until you are going into the OR, just before in the pre-op area. So ask, if you're going to have an operation, you're going to have surgery, ask your surgeon, who's my anesthesiologist going to be? How much experience has that person had in doing this kind of procedure? Because not all anesthesiologists are cut from the same cloth. There are cardiovascular anesthesiologists, there are neuroanesthesiologists, there are anesthesiologists that do various organ systems and are experts in that. So be very specific with your surgeon. Who's going to be my anesthesiologist? Have you worked with them? Do you work well with them? Ask questions. One aspect of anesthesiology malpractice is where the anesthesiologist gives too much medication, and then your blood pressure is lowered, and then they have to administer more medication to make sure your blood pressure is maintained. And if your blood pressure is continually going down, and they keep feeding you medication in order to maintain your blood pressure, oftentimes it's called chasing the blood pressure. It is critical that the anesthesiologist stay on top of your vital signs. Now, oftentimes, they talk about anesthesiology as being like flying a plane, that there can be, complete boredom for most of the surgery, but if something goes wrong, then there's complete terror. It's like taking off and landing the plane is the most critical time. Intubating, bringing the patient out is a critical time. And oftentimes during that procedure, when there's really nothing going on, anesthesiologists can begin to lose concentration and not monitor the patient as much as they should. So for example, I had a case one time where the anesthesiologist was actually not monitoring the patient. Instead, he was on a computer in the OR checking his stocks and not doing the kinds of things that he should have been doing and keeping that patient alive. Unfortunately, the patient succumbed largely in part because of that anesthesiologist's neglect and abandonment of that patient during the surgery. Another example of anesthesia malpractice is when there is a problem with the intubation. Now, when a patient is put under anesthesia, they put an endotracheal tube down the airway so that they can maintain respirations during the surgery. Sometimes it is difficult to intubate a patient. Not all patients are the same. Some people are very easy to intubate, and others are very difficult. There are times when an anesthesiologist thinks that they have the breathing tube, the endotracheal tube, in the trachea, in the airway, but instead they put it in the esophagus. So there's air going into the stomach, not into the lungs, and a patient cannot stand being deprived of oxygen for very long, and the patient can succumb to that kind of thing. So it's important for the anesthesiologist to intubate right and then recognize when there's a failure to intubate and to correct the intubation as quickly as possible.